If you would realize something of the vastness of London, stand with me for a moment and look out over just a section of its northern and eastern districts. This closely packed region bristles with problems of every kind: housing, feeding, and health, more especially the health of its children. And guarding that health like a sentinel stands the Queen's Hospital for Children, founded over 70 years ago, the predominant institution in East London for the treatment of sick and injured children. Before recent additions, the outpatients department was quite inadequate in size. The overcrowding, prolonged waiting was like jostling on a busy morning in a tube. But great improvements have recently been made, and since the new extensions have passed into service, it is possible for the little patients to be dealt with quickly and in far greater comfort. Every morning there come people in trouble about their little ones, but from the moment they get here, some of their anxiety lifts from their hearts, for here is sympathy, here is aid. You must meet Miss Fowler. 58 years ago, she was a probationer here. For 40 years a ward sister, and now presides at the canteen. What a record of service. The new outpatient department is dedicated to the memory of Lady Cooper, a former Lady Mayoress, and a great friend and benefactor to the hospital. Every patient is registered. This young lady you see on the scales guessed that she was to be in a sound film and waxed vociferous. To us laymen, her lungs sounded all right. Patients are first interviewed in one of the 6 spacious consulting rooms. Hello, twins. They don't look in need of a doctor, do they? Most of us have experienced this at some time or another, including the saying of 99. This one probably had to say, ah. Lots of room here now. Many who come are, of course, continuing treatment and renewing the medicines prescribed. This is a daily scene in the dispensary. The windows are kept busy, and so are the dispensers inside. Nearly 500 prescriptions daily, and drugs and medicines alone cost the hospital £2,000 a year. Some cases are accidents, requiring immediate treatment. Formerly, the accommodation for this work was very cramped, but today there are several rooms such as this in which first aid is administered to little sufferers. Here is the Princess Elizabeth ward, named after the daughter of their Majesties. We may mention that His Majesty was for 16 years the President, and since his accession has been the patron of the hospital and follows its progress with the closest interest. Queen Mary is also a much beloved patron of the hospital, and its work receives practical support from all quarters. This cot is, as you see, a gift from the Children's Hour of the BBC. And this one maintained by a great business concern. The hospital provides specialist services in all branches of medicine and surgery, and maintains a splendid equipment of modern apparatus and appliances. This lad is receiving heat ray treatment for a defective leg. The apparatus seems to excite the interest of the other patients somewhat. Well, it may keep their minds off their own troubles, perhaps. The Berkeley ward, one of the first 2 built, named after Joseph Gurneth Berkeley, the hospital's first president. Happiness is the keynote everywhere. Almost all the little patients manage to wear a bright smile, and the sisters and nurses enter into the spirit of the fun too. Each ward has a sun balcony, where the little folk spend much of their time. X-ray is today a vital aid in diagnosis, and a glance at this shows that the equipment here is of the most modern and effective pattern. And this little life crept into the world, but only just. The experience and skill of great specialists and much loving care is exercised on behalf of the frail body, which yet houses the spirit of the great Creator. The value of light as a curative agent has long been recognized, and these patients are receiving violet ray treatment, which, with massage, effects many cures for muscular troubles. Exercises of various kinds play a great part in the treatment of spinal, abdominal and kindred complaints, and the exercise room of the hospital is always busy. Fully qualified masseurs superintend each patient to ensure that, while the full value of the prescribed exercise is obtained, there shall be no risk of strain. Noticing as we pass a tablet recording a memorable royal visit, we reach the orthoptic or sight treatment department. Here patients are taught to correct squint and other eye troubles by ingenious contrivances which compel them quite unconsciously to exercise all the muscles of both eyes, which of itself does much to promote permanent correction. By reading the graduated scales of the instrument or noting the accuracy of these drawings, the operator can judge the progress of each individual case. This operating theatre is equipped with every necessity of surgery. Extreme cleanliness is of course a sine qua non of such a place. The great laundry of the hospital is kept busy handling no less than 10,000 articles per week. Comfort and amenities for the staff are not forgotten. The nursing staffs have a pleasant recreation room equipped with table tennis, dartboards and cards. And I learn that a tennis court too will soon be provided. This is a great moment. These little people are just starting for the hospital's own branch at Bexhill, the little folks' home, where fresh air and sunshine will complete the cures begun at Bethnal Green. In 1938, 324 children were admitted to the seaside branch, which costs over £3,000 a year to maintain, and the money has to be found. This home relieves the constant pressure on the beds in the London institution and enables cures to be completed under the best possible conditions. And as the hospital authorities justly claim, it gives health and happiness to those who need it most when they need it most. Well, these kiddies look happy, don't they? And they are happy. Happy because of returning health, happy because of the kindly care that is bestowed upon them. Happy because thousands of generous-hearted people have given their pence or their guineas to make this great work possible. Wouldn't you like to help also? I'm sure you would. November 1938. Hackney is on tiptoe, for the King and Queen pay a lengthy visit to the hospital, inspecting wards and chatting with staff and patients. While they are walking round, let me take the opportunity of mentioning a few important details. Well over 2,000 children were admitted to the wards in 1938, while over 20,000 new outpatients attended. The total attendance made by outpatients was over 110,000. Think of what that means in time, service, medicine, money. £30,000 are needed to complete paying for recent extensions, reconstructions and improvements, as well as an annual income.
The hospital has made me quite well again.
We can make thousands of others well too, but it takes £40,000 a year to do it.
Now that you have seen the Queen's Hospital for Children, I'm sure that you will want to help. and I'm sure you will help as much as you can, whenever you can.